Hi there. I really need some advice. My 4-year-old son has had a fever for a few days now, and I've been giving him Tylenol every 4 hours, but it doesn't seem to help much. My sister back home suggested that I could alternate Advil syrup with the Tylenol. Is that okay?
Hi, I'm Farah, the pharmacist on duty today. I'm really sorry to hear that. It must be so tough for you. Why don't you have a seat in our private counseling area so we can chat more comfortably?
Thank you so much.
May I have your name, please?
Yes, my name is Isabella.
Nice to meet you, Isabella. And what's your child's name and age?
His name is Mateo Santiago, and he's 4 years old.
Great, and can I ask how much he weighs?
He's about 15 kilograms.
Okay, Isabella. Could you tell me more about Mateo's symptoms? What's been going on?
I'm really worried. He's had a fever for the last 2 days, and I'm not sure if I should be doing anything different to manage it. I've been giving him some children's Tylenol, but I'm starting to think that's not enough. He's feeling pretty off, and he has a runny nose. I came to see if I could use Advil along with the Tylenol to help with his fever.
I completely understand your concern. Fever can be really worrying, especially when it lingers. Let me ask a few questions to make sure we're on the right track. Can you tell me a bit more about Mateo's fever? How high is it, and when does it seem to spike?
His fever has been around 39 Celsius degree for the past couple of days. It tends to get high in the evenings, but it goes down after I give him some Tylenol. He seems to feel a little better for a while, but then it just comes back later.
Thanks for sharing that. It really helps. And how often are you giving him the Tylenol? Are you following the dosing instructions on the bottle?
Yes, I'm giving him a small spoonful of children's Tylenol every 4 hours, but I'm starting to wonder if I should be doing more. Is it safe to keep doing that?
To give you the best recommendations, can I ask a few questions about Mateo's general health and lifestyle?
Sure, go ahead.
Does Mateo have any other symptoms like neck stiffness?
No, his neck seems fine.
Okay, does he feel any pain or swelling in a specific area?
No, nothing like that.
Does he have any cough or wheezing?
No cough.
Good to know. How about a skin rash?
No, he hasn't had any skin rash.
Has he traveled recently?
No, he hasn't.
Any recent surgeries or dental procedures?
No, none of that.
What about his diet? Has he had any raw or uncooked meat or fish recently?
No, I always make sure to cook meat well.
Is Mateo feeling very unwell, being really fussy, or crying a lot more than usual?
No, he's not overly fussy. He's just bit off.
That's reassuring. Does he have any other medical conditions?
No, he's perfectly healthy.
Great. Does he take any prescription medications?
No, nothing at all.
Other than Tylenol, does he take any non-prescription medications?
Yes, I've been giving him saline nasal drops for the runny nose.
That's good to know. Does he have any allergies?
No, he doesn't have any allergies.
Perfect. Thank you for your patience. Fever itself is not harmful. Most likely, the cause of Mateo's fever is a viral infection. Fever is actually a beneficial response by the body to help control and eliminate pathogens. The goal of giving antipyretics is to provide comfort, not necessarily to treat the underlying cause.
Oh, that's reassuring to hear.
I should also mention that alternating Tylenol and Advil is generally not recommended. The clinical benefit of doing this is uncertain, and it hasn't been shown to be safer or more effective in improving discomfort than using a single antipyretic. Plus, using 2 antipyretics can lead to confusion and dosing errors like mixing up doses, which could be risky.
I didn't know that.
Yeah, it's important to get it right. Now let's make sure you're giving the Tylenol correctly. Based on Mateo's weight, the right dose should be 7.5 milliliters of children's Tylenol every 4 to 6 hours, but you shouldn't exceed 5 doses in a 24-hour period. And definitely use an appropriate measuring device.
I'll make sure to do that.
Great. And if he experiences any side effects like abdominal discomfort, you can give him the medication after food.
That sounds fine.
Just a heads up. You should monitor for any rash or allergic reaction to this medication. If you notice anything unusual, don't hesitate to reach out.
I'll keep a close eye on him.
Also, remember to store the medication in locked cabinets to prevent any inappropriate access. Always use a calibrated measuring device. I can show you how to use them. There are many Tylenol formulations available, so it's crucial to read and follow the instructions on the label to avoid errors.
I'll make sure to do that.
Great. Here are some non-drug measures you can try as well. Remove excess clothing and bedding. Increase his fluid intake to replace the water loss during fever. Keep room temperatures around 20-21 Celsius degree and avoid physical exertion.
That sounds manageable.
Starting from now, if the fever continues for more than 24 hours after trying these measures, or if you have any additional concerns, it's always best to consult with your pediatrician. However, if the fever goes away within 24 hours, you can stop giving the fever medicine.
Thank you, Farah. I feel a lot better having talked to you.
You're welcome. Can we give you a call to follow up on Mateo's fever?
Yes, sure, please do. Thank you so much for your help.